Restrictions continue across the country with a panic over a third wave, but what does the data show us? Firstly, looking at the daily deaths linked to COVID-19, we have seen relatively few deaths over the past few months compared to the peak of the first two waves. And actually total deaths from all causes across England and Wales have generally been below average now for 3 months. So COVID is not causing any abnormal effect on mortality. What we do know though is that there has been a rise in COVID-19 cases down to the Delta or Indian variant, as some call it. But is this a cause for concern? The northwest of England is where we started to see the rise in cases. This chart shows the rates among those aged 20 to 24, where the rate is highest, and those aged 60 and over. We can see there has been relatively little increase in the older age group compared to the young. This is important because it is a virus where death is far more likely at older ages. The ratio of cases in the age group of 20 to 24 and those 60 and over is also at an all-time low. This means we are seeing far fewer cases in older people relative to what we are seeing in those younger. Now, it's not surprising we've seen a rise in cases as more people mix, as restrictions ease, but the lack of increase in the older age groups where vaccine coverage is wider provides evidence of a vaccine effect. This pattern is also seen in other areas across the country where cases are starting to rise. We can also bring up the deaths in the northwest, and despite several weeks of rising cases, we have not seen any real rise in the rate of deaths. Remember, it is inevitable that people will die where there was a positive test for COVID-19, so what we're looking for is excess mortality. That's deaths above average, and as I explained earlier, that's below average for the time of year and has been for several weeks. If we look at the data on people going to hospital, far fewer cases are ending up in hospital, linked to the age profile of the cases and again, a vaccine effect. So the vaccine rollout has broken the link between cases, serious illness and death. At the moment, there are 4 times more deaths from pneumonia and flu than COVID, so it does seem disproportionate to continue to impose restrictions on lives that cause wider harms when the effect of the virus is so low.